Hello everyone, and a very warm welcome to this webinar. My name is Ahmed Mustafa and I am the Policy and Political Affairs Officer at the Health Diplomacy Alliance. It's a pleasure to welcome you today. Before we begin, please note that this session will be recorded in line with our privacy policy. The event will include opening statements from our panelists, followed by a moderated discussion and live Q&A session. Please feel free to submit your questions at any time through the Q&A section. If you experience any technical difficulties, please reach out to our support team. The session will be conducted in English and you may activate the translation or caption feature if needed. Thank you for joining us today. Thank you again for joining us in this webinar. This webinar is a part of our Uncertainty That is Predictable series, in which we address key themes at the intersection of geopolitics, diplomacy, and global health. The year 2026 marks a critical crossroad in international relations, defined by shifting geopolitical power balances, emerging alliances, and evolving diplomatic practices. Understanding how these shifts influence the environment in which health decisions are made is essential to advancing effective health foreign policy. It's my pleasure to co-moderate this event with our Executive Director, Catherine Orbais. Catherine, thank you so much for joining us, joining me in guiding today's discussion. And the floor is yours now.
Thank you very much. Thank you, Amadis, and welcome everybody. It's a pleasure also to be with you and co-moderate this discussion. We are grateful for our distinguished panelists and to all of you for joining us from different regions and professional background. We hope that today's exchange helps illustrate how these shifting geopolitical realities are shaping diplomacy, multilateral cooperation, and the broader landscape of diplomacy and global health. Ahmad, for that, I will pass back the floor to you to begin the introduction of the first speakers. Over to you, Ahmad, please.
Thank you so much, Catherine. It's my pleasure to introduce our first speaker. Our first speaker is Professor Olina Shakin. I would like to introduce Professor Olina Shakin. Professor Olina Shakin, thank you so much for joining us today. Yeah, Professor Chong couldn't be with us, so thank you so much. Let me just introduce Professor Olina Shakin. Professor Olina Shakin is the Vice President of International Engagement and Services at King's College London. Professor and Professor of Security, Leadership and Development at the African Leadership Center in King's College at Global Affairs. She is a leading peace and security scholar. Her work connects academia, policy, and practice with research focused on civil war, relapse, youth vulnerability, and exclusion, and links between the leadership, peace, and security. She founded the African Leadership Center in 2010 through a partnership between King's and the University of Nairobi. Previously worked at the United Nations and at Office of Special Representative of the Secretary General, and currently serves as the chair of United Nations University Council. She studied at the University of IF and King's College London, where she completed graduate degrees in war studies. Now, Professor Olina Shakin, in a period marked by recurring conflict, regional instability, and political fragmentation, how should diplomacy and peace building evolve so the security responses do not further weaken international cooperation and human security?
Thank you so much. Thank you so very much, Ahmad. I hope you can hear me very well.
Yes.
I hope you can hear me.
Yes, you are audible,
Excellent.
Professor Shakin.
Excellent. Thank you so much for this kind invitation. I look forward to the discussions that will follow this. But let me just make a few observations in relation to the question that you were just answering. Because the uncertainty in the world, I very much liked the title of this discussion that you sent, uncertainty that is predictable. And that predictability in this moment of uncertainty is shaped by three key things. And that's what I would want to really anchor my conversation around. The first is the way in which social power is in complete contestation with, you know, if you like, the economic and political power, where social power is characterized by power diffusion, that you see citizens globally uh, really taking their own voice, really owning their own voice and agency across a whole range of things. But at the same time, you then have government still being the same way, state power still being narrowly held by the decision making of a chosen few. Economic power itself is probably also becoming somewhat diffused, but you still see a lot of social exclusion. That means that economic power is resting in the hands of a few. I would like, therefore, in the second observation I want to make, to really draw attention to the way in which the power dynamics of the global south and the global north is shifting. In a multipolar world, where the less powerful nations have also begun to own their own voice. And you can look at parts of Asia and Latin America, but certainly Africa, where you're seeing a consensus about how to begin to redefine the ways in which those regions, those states, especially their peoples, contribute to the question of power and agency in the world, that states who can really begin to dictate the use and ownership of the natural resources. And you see that in the way that the COP conversations have been going for the past few years. And people who are able to use the social space to express themselves differently are beginning to express the agency in a variety of ways. And the protest by the vast majority of people globally is becoming the order of the day. And we never really check what that protest is about. So you see the power distance, the contestation between the state and its peoples at times, or also between more powerful states and the less powerful ones who can anchor the conversation around their resources. So this is very important to note, that even though it's a period of uncertainty, there's a predictability to which the less powerful people and less powerful nations are beginning to articulate their needs and their ambitions globally. And I want to move to a third one, which is a more significant one, the recurrence of violent conflict. And I think that is the challenge that the United Nations and the rest of the international community is going to see for some time. The mutations, the transmutation of violent conflict and civil, or in fact, armed conflict generally. This is not just about civil wars. We're seeing the interstate conflicts that are becoming the order of the day, not just Ukraine, Russia. We're seeing what is happening in the Middle East at the moment with Iran and the US and Israel, that this tells us about some of the shape of things to come and how a symmetrical conflict is the thing that will really shape the recurrence of violence for some time. But underpinning that is the fact, is the very idea. Underpinning that is the very idea. I hope you can still hear me. That
Yes.
we can't, yeah, thank you. Is the very idea that we cannot create communities of people that have nothing to lose and expect that there will be peace and stability. When we have created a community of people that are excluded from the power structures globally and within their own countries, we're likely to see societies go up in flame until we take the agency of those people into account, of those societies and the communities into account. So you can see at two levels, people in society fighting the state. Example of Iran and the protests is not just Iran, there are many other states, but yet a titanic struggle in terms of contestation between states in the global south, in parts of the global south, and in the global north. If this does not change in terms of how we renegotiate the state, or how we negotiate the global power structures, we're going to see a relapsing conflict over and over again. Let me conclude with a statement that in one of my recent publications in the last couple of years, I talked about the owners of peace and the beholders of peace. The real owners of peace are those who are at the front line of all of these contestations, who live through war and peace on a daily basis, who have to be the ones who anchor society's reconstruction, who live through it and help the rest of communities recover from war, from health, from the health and other social impacts of it. They are the ones with the agency whose views should be written into peace agreements, whose views should be written into societal reconstruction. Then there are the beholders of peace, the distant observers of peace, who may have a vested interest either because they want to contribute to peace or they have a vested interest because they want to continue conflict for their personal interests. These spoilers will also be, will like to be at the front line, but they're not the real owners of peace. And unless we have an inclusive conversation globally about how people can live long and live well, fundamentally, and have a sense of belonging in their societies and contribute to the decision making about the day-to-day living, we cannot have peace within states or between states. So that uncertainty that we see has some predictability at the heart of it, and it requires us to change the societal structures of power as well as the global structures of power. I'll leave it there. Thank you so much.
Thank you very much, Professor. And it's definitely that's part of the series of events that the health diplomacy is hosting. Is this uncertainty that we know that is predictable, and the fact that you have brought into how national behaviors come and influence what we're seeing at the global level, and how conflicts continue to be really driving the discussions in terms of diplomacy. That's an interesting point of view. And what we want to see is how that aligns in terms of how that reflects into global health. And for that, our next speaker that I have the pleasure to introduce is Professor Ole Peterson. He's a Norwegian physician and neuroscientist. His whole bio is in the chat. Please look at his whole bio. He's also a professor of medicine at the University of Oslo, and he's affiliated to the Karolinska Institute. He was also president of the Karolinska Institute and rector of the University of Oslo. He don't need much introduction. For me, it's a pleasure. He's also, I have to say, he's also in leadership of the Lancet Commission of Global Governance and Health, and Global Governance for Health 2.0. And he's also the co-chair of the International Working Group on One Health Governance and Policy, who I got the pleasure to co-chair with. It is my pleasure now, Professor Ole Peterson, going in reflecting into this, how do you see in terms of, we see that there is this geopolitical rivalry that has been mentioned, and multilateralism comes under strain into all this process. Where do you see that there is the greatest risk for global health governance? And I mean, this is a compounded question. And what kind of diplomatic reform, as we are talking about reforms of the system, is now needed to keep this international health cooperation somehow functional? Over to you, Professor Peterson.
Thank you, Catherine, and thank you for inviting me to this very important discussion. And also thank you, Professor Ullensaken, for your very insightful introduction to this theme. So I have to be very modest because I'm not a political scientist at all. I'm a medical doctor, neuroscientist. But as you said, Catherine, I happen to be the president of Karolinska Institute for a number of years. And what I saw, of course, was a very sad evolution of health, and particularly global health. And the key word in this context is, of course, the growing inequity between different nations, between the global south and the global north, and also the difficulties that were laid bare during the pandemic, the COVID-19 pandemic, where we saw all these inequities at close range. And also we saw how these inequities were difficult to deal with. So from the point of view of being a medical doctor and a neuroscientist, in fact, I have arrived at some of the very same conclusions that political scientists usually converge on, and I'm very much aligned also with Professor Olonisakin's views on what needs to be done. I will go straight to a conclusion in 5 points as to how we in the Lancet Commission, which is working on the geopolitical determinants now of global health, how we look at the future when it comes to multilateralism. And first of all, of course, I have to emphasize that global health is in dire straits, in a very, very difficult situation, as you know. One thing are all the inequities that we are seeing now, and some of them are deepening. But the other thing that really is a new development in many ways is that health and healthcare and even healthcare institutions are victims of conflicts and war. We are departing from the rule-based order. We are departing from the international law, international rules that should govern the relationship between nations, both in peace and war. In fact, all of these issues, they impact health in a very serious way. So, and of course, what we are seeing now, and this is something that I'm personally involved in many ways to see what are the negative impacts of the undermining of the multilateral system that we have lived with since the last World War. For example, the US withdrawal from WHO, from the Paris Agreement, and also, of course, the discontinuation of US AID. Only the latter thing is projected to lead to a bit more than 14 million deaths by 2030, although there are many different analyses around. So we are in a very, very difficult situation when it comes to global health. And obviously, we have to be extremely creative as to how we could rekindle or restore at least part of the multilateral system that used to benefit global health, even though that multilateral system was not really perfect either. But 5 points that I think we should discuss, and which are at the intersection between global health and political science, and that have everything to do with the multilateral system that will be a key point in the discussion, I guess, also during this seminar. One, of course, the first point is that we should all resist the dismantling of the global health infrastructure and the global health organizations that have served global health pretty well over many, many years. We have to retain at least a part of the global health structure that we have had until now, because there are obviously many different challenges globally that cannot be handled at other levels than the global one. So we need to retain part of the global health structure. The second thing, which is so important, is that when we now redesign a new global health architecture, we should not be nostalgic. We should not believe that we should go straight back to the old world order, because that was not perfect either. And that leads us to point number 3. When we try to come up with a new multilateral system, and Professor Olenisakin was touching upon this, we have to enter into a much more just structure where voices from the global south can be heard proportionately to the role and the population and the innovative power also of the global south. So we have to restructure the global system with an appropriate focus on justice and representativeness. And included in this point number 3 is, of course, that we have to look for regionalization of the global health architecture. There are many regions that now can take over many of the functions that used to belong to the global level, like in Africa with Africa CDC, which has stepped up to be a power really a powerhouse for improving health in Africa. So regionalization of global health is important. The fourth is agency and leadership of the global south. I touched upon this already. And the fifth is very, very important, and that is to change the way we are collaborating on the global level from the more acute way of collaborating, providing vaccines, for example, when an epidemic comes along. We should rather have a much more long-term collaboration, building capacities and capabilities, including, for example, capacity for vaccine production in the global south, so that next time a crisis hits, we will not be dependent on charity and which is not really very well developed, as we have seen during the pandemic, but we should depend on, in fact, the more self-reliant approach to vaccine coverage, like having local vaccine production. On top of all these 5 points, of course, we have to look at the debt situation. Debt relief is mandatory to allow Africa and the global south to invest more in health and healthcare. And also we have to look at governance frameworks, so that governance frameworks can be more attuned to one health challenge rather than simply be attuned to human health. So these are the 5 points that I think we could be discussing as a productive way forward. Thank you.
Thank you, Professor Otterson, for that essential framing of the risk facing global health governance today. We have now heard the initial statement from our panelists, and we will move into the interactive part of our session. Thank you those who have already submitted questions through the chat and Q&A section. Please continue participating. We will address as many questions as the time allows. We will begin with the first round of our moderated question for our panelists, and then incorporate questions from the audience. I now pass the floor to my co-moderator, Catherine, to open our moderated discussion. Catherine, over to you.
Thank you very much, Amat, and thank you for those reflections, which are really timely. Please do not hesitate to raise your hands or push your questions into the Q&A. But I will take profit of these discussions, and I will go back to you, to Professor Olunishakin. Bringing into these discussions on the diplomatic and peace building, how do you see these actors responding to conflict under regional insecurity without reinforcing these zero-sum logics that further weaken cooperation and human security, especially during this context? Over to you.
Thank you so much. I think I really liked the intervention of Professor Lepita just now, because what he's asking in terms of a just world going forward, when we restructure the global governance architecture, or the global architectures as a whole, the various ones in addition to health, is that we actually need to think radically differently about conflict, about peace and diplomacy. Because at the moment, the way the response to conflict is structured, the way the diplomatic responses are structured, and that's what I was trying to allude to about owners and beholders of peace, is that for as long as our diplomatic efforts focus on the protagonists of war and those who bear arms, without thinking about a leadership infrastructure that brings the whole of society, the whole of the communities that are impacted, but also have various forms of agencies in the regions where we make conflict. If we standardize, if we stay with the standard approaches to conflict, which represents only formal actors, state actors, those who bear arms, we will reinforce the injustices of the world. One of the proposals I've made for some time is that we start thinking of, and if you've seen how peace building processes have been traditionally, even though that is changing, we think about peace consolidation more. We think about peace agreements, peacekeeping, then elections, right? Who actually sits in elections? It's like the actual protagonists. In South Sudan, it's exactly what we did. We had elections quickly, and it's those who had been bearing arms, who had been fighting, that also became the leaders of the country. Now, had we had a different kind of election through plebiscite by asking members of society to vote for national priorities, the terms on which you will live together, vote on that first, also vote on how you share the natural resources and the resources, the revenue allocation process in the country, before you ask them to vote for who they think are well placed to lead their countries or their societies. That pattern allows general participation in a peace process. So I think there are blind spots, even in some of the work we did at the United Nations, and those blind spots continue to reinforce the diplomatic process and the approaches to peacemaking in a way that regional instability becomes cyclical. And I think that needs major restructuring over time. Thank you.
Thank you, Professor Olina Shakin. Professor Otterson, what practical reform would most help global health institutions remain functional when the political trust is low and international cooperation is increasingly fragmented?
Yes, so fragmentation, that's exactly an issue that is impacting now global health. And so what are the measures that one should take more in a more concrete way? So I touched upon this already. I think it's absolutely essential now to be very concrete, that we look at how regions can take over the responsibility for part of the global health that usually belong to the global health institutions. And I think the world is ripe, is ready for a much, much stronger regional involvement. I mentioned Africa CDC, the Center for Disease Control in Africa, which I think is a stellar example of an organization that is now stepping up and can sort of take over some, as I said, responsibility that previously belonged to the global level. And also, of course, what is happening in the discourse in Africa. And Professor Sakin can, I'm sure, attest to this, is that now there is a very clear motivation for a stronger national ownership when it comes to global health. Yeah, global health, more self-reliance, and stronger emphasis on building capacity and capabilities when it comes, as I said, for example, to vaccine production. So, you know, every cloud has a silver lining. I think the erosion of the multilateral system that we are seeing now, it also has a sort of positive impact, because it creates an understanding that individual nations and regions, they have to step up and pave the way for a world that is more self-sufficient, more self-reliant. And I think we already are on a very good track when it comes to this development. There is another very important thing which I think we should be aware of, and that is that when it comes to development aid and philanthropic institutions, again, countries must take a stronger ownership, so that philanthropic assistance and development assistance can be much more attuned to and aligned with the national priorities. What we are seeing in Africa, for example, is that they have to very often adjust their strategies to the individual philanthropic actor, which of course makes the healthcare system very fragmented. So there are many different concrete ways I think we can pursue in order to come up with a multilateral system that is more just and much more balanced than the previous one when it comes to the relationship, for example, between Global South and Global North. Thank you.
Thank you very much. I want to go back to the discussions about the importance and the increase of this regional perspective. And I want to ask Professor Olonishakin, in your experience, how do you see that policymakers are taking this regional leadership and the context specific of diplomacy to really unite itself in terms to secure or somehow avoid this fragmentation and this recurring insecurity? How do you see the regions reacting to that, especially those regions that are currently on a conflict situation? I think you're mute, Professor Olonishakin.
I'm so sorry. Hey, I'm so
No
sorry.
worries.
I was just saying that honestly, we're going to see more fragmentation before we see any kind of peace consolidation at regional level. Okay. Why do I say that? Because even regional institutions are falling into, but I have to really demarcate what is happening in the area of health and education from the area of security. But I think that unless the fragmentation in the area of security is addressed, you cannot really deal with health and education. It will just be at the level of, you know, at the level of statements, at the level of rhetoric. And by the way, the reason for that fragmentation is that regional organizations have become far more ineffective, not across the board. Take Africa, for example, the normative framework that was established to try to bring the whole of Africa together and get continental and regional bodies as, if you like, subsidiaries of a continental peace and security architecture that has failed woefully to address conflict in the Sahel, in Sudan, in different parts of the Horn of Africa as a whole. And so therefore what you see is a very negative multipolar order in which all sorts of middle powers are interfering in conflict in Africa. And that is why the conflict, for example, in the Sudan has become so intractable, all sorts of intervention in those conflicts. So the regional institutions themselves have failed to resolve that. And so you see a retreat to that fragmented pockets of power dynamics of intervention. And I think it's important to really say that that fragmentation will happen before we see a consolidation. And it will require that everybody has the same view about the direction of travel before you see any change. And for as long as conflict continues, all the lofty goals and agendas that we have around education and health cannot happen. We keep seeing UNHCR trying to provide education in conflict-affected regions in different ways, and they're doing a fantastic job. What Prof. Olepita just talked about in terms of Africa CDC is a reality. But look at different regions of the world. Even in Eastern Europe at the moment, you cannot see, you cannot see a consolidation of peace in any direction unless the global architecture that made Ukraine possible, that has made what we've seen in the Middle East possible, is repaired. And that repair actually has to see inclusivity of all agendas as part of what as part of that reform process. I'm not suggesting that we return, and I think that's also what it's not what Olepita is suggesting, that we return to the multilateral system the way it has been, because it needs repair. If it is not repaired, we're just going to see a dismantling and a fragmentation of all sorts of responses across the board. And are there ideas in some of the fragmented spaces? Yes, there are, because it's not everything that is violent. You actually find pockets of peace, pockets of peacemaking that are responding to societal realities. But we need to consolidate this by really rethinking the agenda. Thank you.
Thank you very much. That's a really good reflection. And I come to another aspect if I bring this discussion into the health arena. And I will address this question to Professor Olipita. Um, and if you are able to answer that, I think you are able to resolve the aim of what the Health Diplomacy Alliance is for. So how we position health more effectively within foreign policy, so it's not treated, especially when we are on this geopolitical tension, that is not treated as a siloed technical soft issue, but more as a strategic diplomacy priority.
Yeah, this is a very, very important question. Of course, we are in a situation now where we are far from what we experienced under the old multilateral system, where health, in many ways, improved health was seen as a goal in itself, even across national borders. And, the establishment, after all, of USAID was, even though it had also elements of power embedded in it, it had a true, it was based on a true understanding of the fact that health in one country depends very much on good health in all other countries, that we are very much intertwined when it comes to health. This understanding now has been eroded along with the erosion of values and global solidarity. So what should one do to really get health much more firmly embedded in politics and foreign politics, not least? Well, one thing that is so important, and we had a Lancet Commission just 2-3 years ago that investigated this, is to make policymakers convinced that there is a very strong link between health equity, and also gender equality and peace. This Lancet Commission, published 2023, went through all the research and literature on this issue, and I think the evidence is sufficiently convincing so that one can approach policymakers to really make them understand that a way to peace goes, among other things, through a focus on health equity and also then gender equality. Another very important thing, and Catherine, you are yourself very much involved in this, is to make policymakers understand that human health is so tightly integrated with the climate challenge, and also with animal health and the risk of new epidemics, so that policymakers should be encouraged to develop governance structures for in the context of One Health. One Health then being the arena where we see the interconnectedness between climate, animal health, and human health. So I think these are two different pathways that we should pursue in order to make policymakers convinced that health is a very important element, should be a very important element also in foreign politics. The One Health aspect, and also, of course, the aspect that has to do with the link between health inequity and peace. Over to you.
Thank you, Professor Otterson. I would like now to open the floor to the questions that have come in through the chat and Q&A section. We have the first question that is for Professor Olina Shakin. Professor Olina Shakin, where do you still see the strongest opening for credible collecting action despite fragmentation?
Thank you so much. I think the strongest opening will be amongst particular state. It's almost like an odd combination of member states, because now you see zones of actions either by a small coalition of states or by parts of civil society operating by state, state-based actors. The fragmentation is of such that if we don't watch where you're seeing positive movements, we miss them. If I return to not South Sudan, but to Sudan in particular, what is holding that country together at this point in time is a host of critical local, if I may, national actors who are a coalition across the board. Interestingly, it was this sort of coalition that brought down Bashir's government in the first instance, right? That kind of coalition in a different form is holding at civil society level. That is the only thing that is breathing life into Sudan at the moment. And if one does not lend support to that coalition, to that group of a collection of local agencies, local civil society, who at all costs on the front lines are keeping that place going. If we don't give credence to it and support it, then we don't even have an entry point to try to promote a movement towards peace. But let me also make a theoretical assertion, because it's not something we practice a lot. But every time that you see health used at the forefront of peacemaking, it sticks. Like how we ask for warring parties to give room for vaccination sometimes, warring factions to allow us to use health responses. If there's an epidemic somewhere, to respond to people, it actually opens the space for a ceasefire or for some kind of quiet period through which we can pursue peace. And actually, I think in the end, being deliberate about using health entry points in very difficult environments might be one of the ways in which we can repeatedly open the door to peace. We use it less and less, and I think there's potential to use it. Even during elections, we can put a health priority in those elections, because people tend to respond and rally around, non-conflictual issues. Where do you find common ground the most? It's around humanitarian response. It's around health response, because the whole of society needs it. Even warring factions need it. We don't do that nearly enough. Thank you.
Thank you very much. I'm following on what I see in the chat in the Q&A, and I see some comments about some of the discussions about climate health, animal health, and also the ecosystem, the planetary health, which is a broader perspective, and there is a lot of discussions on that aspect. But I want to bring into that a question that has been one of the major discussions right now is by Cynthia Dushime. So what is the role that major donors and private sectors partners are playing in restructuring global health governance and considering their critical implications in power and decision making? I think this is addressed to you, Professor Orlette Peterson. You already mentioned about that, but I pass the floor to you.
Yeah, I think I touched upon this. It's a very, very important question. As I said, and this is based also on my own experience from working in Africa, that many nations that are dependent or have been dependent on philanthropic assistance and developmental assistance, of course, they have to readjust their strategies to match the agenda of the philanthropic actors. And this makes it very, very difficult for many nations to really benefit from aid and philanthropic investments to build a full-fledged and coherent healthcare system. I think that many others have arrived at the same conclusion, that somehow the different states must develop a much better ownership through the financial streams, the financial money influx from philanthropic actors and also from nations providing official development aid. Otherwise, the fragmentation will just continue and perhaps even be exacerbated. So this is a structural change that has to happen, and it has to happen pretty fast. So how this could be organized, that's not easy to see, but I think that one has to develop an understanding also at the level of the philanthropic organizations that their support must fit into the wholeness. I mean, the strategy that each and every nation has for the development of healthcare and health for their own population.
Thank you very much. I take this opportunity, and we see that Professor Jan Lanchon is with us, and there is a question that I would not like to skip. And Professor Lanchon, are you able to hear us? I think he had some difficulties before. Yes. So I want to ask some questions and to bring a little bit the elephant in the room when major of this discussion and geopolitical discussions comes into place. How do you see that states are adjusting to anticipate this USA-China competition? And does this tell us about the future of a strategy, autonomy, regional order, and issue-based cooperations in challenges, not only in supply chains, but how do you see that major geopolitical tension between both powers in that sense? And welcome to the discussion.
Yep, so sorry again for joining late. So I think with the intensification of US PRC competition, I've heard earlier in the conversation about the politicization of global health, just like it's a politicization of so much others, which means to say that while I think I mean, people like to think that actors are working in good faith. However, the truth is that everything, including global health, are being leveraged as means to get an advantage over the other, are also used as a way to advance their own positions. I think the sort of best example that the most evident example of this that we see was the stuff over the sort of competition over vaccines that we saw during COVID, which means to say that we can't imagine that global health is separate from a lot of this contestation, and any plan to sort of actually advance health for people who need it needs to the strategies and the structures and the policies in place have to take into account how to address these different kinds of concerns. That may mean having to work with some agendas, that may mean having to work around some agendas, that may mean having to try to get over certain agendas. That has to be a lot more part of the planning these days, I guess. That was part of the conversation earlier. The other thing that I'd like to just quickly add here with the US PRC competition and sort of not believing that actors are working in good faith is that one of the problems that we see, we talked earlier about issues with funding, one of the problems here is that things that are in the realm of global health and are for the general public good are being couched and recast as somehow not so, right? So the claims about health and other global public goods being at odds with national interests, that people are taught to be skeptical of these things. So I suppose any global health approach going forward needs to account for these narratives, needs to account for these efforts to push this information ahead of time, because if that's something major powers are doing, actors that want to actually see some good come of this have to sort of adjust and address those kinds of narratives, unfortunately. Yeah, I hope that gets at your questions.
Thank you very much. Yes, I think my colleague Ahmad will give another question, but I want to take a question from the chat. As an early career research and Ethiopian interested in global health diplomacy, I was wondering what practical ways exist for successful investment in building negotiation and diplomatic capacity among health leaders to strengthen the role in global decision making, especially for low middle income countries, so that health diplomacy isn't solely in the hands of political leaders of foreign affairs, but in the hands of responsible health leader as a political good. I don't know if any advice for an early career research in terms of those skills that are needed from any of the professors on that side. I don't know if the question is addressed to any of you.
Get political skills. That's useful these days, I'd say.
And flexibility, I will say, and be flexible in terms of those changes. My colleague Ahmad might jump into another question to Professor Chong. Ahmad, please. You're muted, Ahmad. It's still
sorry,
muted.
You're muted. You're muted. I can't hear you. Sorry.
My apology for that. Thank you, Professor Chong. Professor Chong, issue-based cooperation is becoming more important in the contested environment. Now that we see that the major power rivalries, we are seeing that in the US and Iran war, the strategic environment is very contested. So where do you still see room for meaningful collaboration on supply chain, specifically health security and other transnational challenges, despite a strategic rivalry between maybe the US and China, are the major states?
So I would actually, my answer would be for other states and also international organizations to think about alternatives. I mean, the US and the PRC are tremendously important. There's no way getting around them. But unfortunately, we're in a situation where increasingly what Beijing sees as positive, Washington sees as less so, and vice versa. So what that means is when you think about supply chains, when you think about access to medicines, or even you can think about microchips that go into medical machinery and things like that. Think about alternative routes that might maybe you may have to put up some upfront. There may be some upfront cost involved, but what you get in exchange is having more stability in supply by trying to circumvent things that get into a lot of the rivalries. I mean, if we think about the current blockages around the Strait of Hormuz, I mean, that's just oil, right? But we see blockages of a lot of other things. I think that suggests what that is. I think signifies is a need to sort of think about, okay, should we be as dependent on these same few sources? If we can diversify, what we can diversify, where can we do it? So when it comes to issue-based kinds of approaches, well, are there countries and organizations that have particular areas that they really want to work on? Say, whether it's looking at, say, HIV/AIDS, for instance. Well, a lot of the medicines and patents and all that, they come from certain places, but are there ways to develop alternatives such that there's some degree of redundancy, I guess is the point. I mean, that's my thinking in terms of trying to, look in terms of how to mitigate the volatility and the risk of major power competition.
Yeah. Thank you very much. I think we are running out of time, and there is so many questions that have come out and other discussions. But one of the questions that still stay is how we prepare for this uncertainty. We know it's predictable, we know it's coming, we know it's complex, but how we prepare, in one word, how we prepare for everything that is happening before we could have every event that happens in a cyclical mode, so historians can really testify to it. But right now we have changes that happen in 30 minutes, in 20 minutes. So the chip is so fast. How we prepare for that uncertainty? Just a simple answer from both of the speakers.
redundancy. Before we thought about fast in and out, but I don't think we can have that luxury anymore.
Professor Lepita.
Well, one thing is that we need to have much more scenario planning, I think, where we can model what is happening, despite the fact, of course, that we really don't know exactly how things develop. But the nature of the changes that we see is something that we know quite a lot about. We don't know where things will end up, but I think that scenario planning will be a key, in fact, to see how we can manage these pretty overwhelming changes that we're seeing now and that undermine the global health landscape.
Thank you very much. Many thanks for this rich dialogue. I wish we could have more time, but that shows how deeply geopolitical shifts are reshaping the environment and will health decisions are being made, and why and how health diplomacy is more essential than ever. Several key insights have emerged of today's first, the witness of genuine transformation of the multilateral order, how institutions and norms are shaping over the past decades and that are under pressures and that they require reforms, both with political will and a strategic diplomatic engagement. The fragmentation of alliances and the rise of transnational diplomacy, as we've seen, and also the dimension in terms of regional perspective that are not peripheral to the global governance reform and to the diplomacy as a whole. Finally, health diplomacy, as it was mentioned, is not a soft kill, is a really instrument from foreign policy. It is a strategic imperative. So connecting health security to the broader agenda of peace, development, equity, and all the discussions of foreign policies is necessary to advance on resilience and sustainable system. I thank you, all of you, for participating in this event, to the distinguished panelists for bringing their expertise. I know that there is many things that we did not cover. I also want to thank my co-moderator, Ahmad Mujawab, and the team of the Alliance. And as I want to do some marketing based on these discussions. And before we close, we want to warmly invite you to join the Health Diplomacy House, which will take place on the 21st of May in parallel to the 79th World Health Assembly in Geneva, for those ones who are going to be in Geneva, where we're going to continue these conversations in terms of geopolitical changes and reform. We wish you a wonderful rest of the day, and please stay tuned to the upcoming work of the Alliance. And thank you all for participating in this event. Thank you very much.
Thank you.
Thank you.